Welcome back to another Medtech Snapshot. We are in a three-series discussion today with Mr. Jeff Gable, and we're talking about agile development, specifically within new product development, but as we're kind of getting into more of that design inputs phase. So Jeff, in our second discussion, had actually been talking about really as you look at doing extensive prototyping on the front end, as well as looking at your requirements and how you integrate that into your process. And Jeff, so as we get into this last part of the discussion today, kind of take us through what you're going to be talking about here.
Piggybacking off my original episode with you, the 4 points that I raised, points 3 and 4, my third point was for those version 1 requirements, the first time you're actually putting your product out, you need to flesh them out rigorously and in detail early. And this is where there's going to be a tight feedback loop between requirements and your system design and architecture. You're going to flesh out some requirements. You're going to try to build a system architecture that achieves those, and you may discover that something's not feasible, at which point you need to go back and revisit those requirements. But the key point that I want to make sure people don't, a trap that people don't want to fall into, is letting requirements be TBD, to be determined, for too long. And I've seen it over and over again where people kind of just get tired of writing requirements and they want to get to the engineering soon. And they'll just say, okay, well, TBD, we'll figure that out later. And those things can often be key problems, like where you've assumed something is possible or assumed something is reasonable, and it turns out not to be. And so really, really recognizing the difference where you're saying TBD because you truly don't have enough information and you need to go build something before you know enough to know what the requirement should be. And when you've put TBD just because you're being lazy and because you don't actually want to think through that design work. And when you posted your first episode that we recorded together, I think Matthew Romney on LinkedIn pointed out that a lot of people have a design gate, a gate in their process where essentially there can't be any TBDs in their requirements before they move to the next phase. And I think that's a good practice. It may be a little too rigid. There is certainly, you want to do a lot of iterations and actually start building things, but it's just that design work of fleshing out those requirements to their full level of detail. You should try to do that as early as possible. The other point I wanted to make was, even with those fleshed out requirements, once you start building, you will inevitably learn things. You will realize that you missed requirements. You will realize that a certain way you thought your instrument was going to work doesn't work. And you're going to need to go back and update requirements and then make sure that all of your test protocols and all of your design documents reflect those new requirements and that everything traces. And this is where having proper lifecycle management tooling can really save you. And I like to say, friends don't let friends track requirements and test cases in Word and Excel. They're just not built for that. It's a lot of manual tracing, and especially for any complex device where you could have hundreds of requirements and hundreds of test cases. Making sure that those all trace together, and especially as things are changing and evolving during your design process, that could be a very, very painful, tedious, error-prone process to do that manually. You should be working in a tool like Matrix or Jama. Even Greenlight Guru has a module that does not a QMS, but requirements tracing. But Matrix and Jama are the two that I recommend most often. But those tools are built to manage those requirements and test cases and traceability, and they will take a lot of work off your plate.